In this section, we will learn about other considerations, such as domestic violence, parental substance abuse, and homeless children, parents-caregiver contact, and safe sleep policies. There are situations that do not fit perfectly into the 4 categories of abuse as described by CANRA. They are domestic violence, parental substance abuse, homeless children. Children who witness domestic violence tend to be more aggressive and anxious than children from nonviolent homes and are less likely to be successful in school and social activities. They are at a higher risk for delinquent behavior, separation anxiety, developmental regression, and sleep problems including nightmares. Although making a suspected abuse report is not always mandated in domestic violence situations, domestic violence may be reported as emotional abuse. Children who have not observed the incident are usually aware of the violence, even if others believe they were asleep or otherwise engaged, and it is important to ensure their safety, both physical and psychological. A suspected child abuse report should be made in order to allow investigative agencies to conduct a thorough assessment. Children are more likely to be subject to abuse and neglect in homes where substance abuse occurs. Children in these homes often suffer from a variety of physical, mental, and emotional health problems. In addition, increased stress and preoccupation with drugs or alcohol by the parent, combined with behavioral problems exhibited by the child, increases the risk of maltreatment. Another consequence of parental substance abuse is the exposure of children to these substances. This exposure can be either passive, for example, when substances are smoked by caregivers in the presence of children, or intentional, for example, when caregivers use drugs to sedate a child. Reporting to a Child Protective Services, though not always mandated in cases of substance abuse, is strongly encouraged. It is estimated that there are hundreds of thousands of homeless children in California. Many live in shelters, rundown motels, with relatives, or with multiple families living in a single-family dwelling. They may appear unkempt and have poor attendance, nutrition, and hygiene. They often fit the profile of an abused or neglected child, but are rather the victims of economic conditions or personal family misfortunes. While economic disadvantage should not be confused with abuse, it is also true that homeless children may be subjected to environmental factors such as drug abuse, family violence, and multiple families sharing a dwelling that puts them at a higher risk of abuse. If you become aware that there are homeless children among those with whom you have contact, it is appropriate to be especially observant and attentive to these children and supportive of the special challenges they may face. Please check with your facility of who is the point of contact in these situations. In situations where the child care provider is contacted by the parent or caregiver regarding a report, it is important to respond in a professional, direct, and honest manner. Avoid revealing information relevant to the child abuse report. Avoid betraying the child's confidence. Inform the parent, if necessary, that their current conversation with you may not be kept confidential. Any threats or admissions of maltreatment must be reported. Finally, in cases where a report is unsubstantiated, or the provider has concerns that do not rise to his or her reporting threshold, keeping a confidential written record of concerns and observations is crucial. Child care providers who care for babies less than 12 months old should be aware of the risk of sudden infant death syndrome, SIDS. According to the American Academy of Pediatrics, SIDS is the leading cause of death in infants and is most common to those who are 1 to 4 months old. The following guidelines should be followed to lower the risk of SIDS. Infants should always be placed on their backs to sleep. Infants should be placed on a firm sleep surface with a fitted sheet free of things that can make it difficult for them to breathe, and should be alone in the crib. Infants should sleep in a room that is comfortable in temperature, in a range that would be comfortable for a lightly clothed adult. Infants should sleep in an area that is always smoke-free. It is also important to talk with parents about how their baby sleeps and to share information about your safe sleep policy with them. You may be able to provide education and support to parents. If there are concerns or special situations that require different sleeping arrangements for an infant in your care, You may also need to request a letter from the child's medical provider detailing any special arrangements that need to be made.
Well, it's just a start. We have a lot of decorating to do to make it just right.
Oh, it's so sunny and bright. It's perfect. And you already have the crib. Now look what I just got.
Pretty fancy, Mom. Want me to show you how to use it?
Are you kidding? I got this thing all figured out. I even have your baby pictures on here already. Look how cute you were here sleeping with the blanket and Animate.
You know, today we don't put blankets in the crib no matter how cute they are. And we have to lay the baby down to sleep on their back every time. You've heard of SIDS, right?
Oh, yes. That's when the baby dies unexpectedly during sleep, and doctors can't find an explanation.
Right. Sudden infant death syndrome. At our birthing classes, we learned there are a lot of different things we need to do to reduce the risk of SIDS and other sleep-related causes of infant death, such as accidental suffocation.
Who knows what goes in a crib?
I know. A sheet?
A blanket?
Soft bumpers.
A teddy bear?
One of you is right, and the rest are wrong. Over the past 20 years, researchers have learned a lot about safe infant sleep. Besides the baby, a fitted sheet in a safety-approved crib is the only thing you need. No loose bedding, no bumpers, no pillows, no teddy bears, and no blankets.
Check it out. Marco brought home this bassinet to keep in our bedroom. For the first couple of months, the baby will sleep right here in our room, next to where we sleep.
Oh, no, Jellybean. You're going to want that baby sleeping right next to you in bed for those feedings through the night.
Our instructor said that bed sharing actually increases baby's risk for SIDS, not to mention increasing the baby's chance of suffocating or being fatally injured.
You sure are developing a mother's instinct, honey. I know things change. I'll do it the new way. Because my new granddaughter is going to grow up to be an amazing woman, just like her mother.
For more information, please visit the Safe to Sleep website at safetosleep.nichd.nih.gov.